Your hips are lying to you right now. They feel fine when you're sitting, maybe a little stiff when you stand up. But here's what's actually happening. Every hour you sit, your hip flexors shorten by 0.03 millimeters. Multiply that by 8 hours a day, 5 days a week, 52 weeks a year for 20 years, and you've got hip flexors that are permanently contracted by over 4 inches. But here's what nobody tells you. This isn't just about tight hips. It's the root cause of your back pain, your knee problems, your balance issues, and why you feel 20 years older than you are. Look at a toddler squat down to pick up a toy. Perfect form, flat feet, hips open, back straight. Now think about yourself trying to tie your shoes. That difference? That's exactly what 20 years of sitting has stolen from you. And here's the thing. Your doctor calls it normal aging. Your physical therapist gives you stretches that provide maybe 20 minutes of relief. But 700 years ago, samurai warriors discovered something that modern medicine is only now beginning to understand. There's one specific movement, kept secret in Japanese dojos for generations, that doesn't just stretch your hips, it actually reverses the structural damage at a cellular level. This isn't about managing your decline or learning to live with stiffness. This is about rebuilding what sitting destroyed. Before I show you this movement, I need you to understand exactly what's happened to your body and why this ancient technique works when everything else fails. Drop a comment right now and tell me, how many years have you been sitting at a desk or in a car? I want to know what we're reversing together. And if you're ready to take back the mobility you thought was gone forever, hit that subscribe button because we're about to dive deep into the science and the solution. Look at a toddler squat down to pick up a toy. Perfect form, flat feet, hips open, back straight. Now look at yourself trying to tie your shoes. That difference? That's what 20 years of sitting has stolen from you. But here's what makes this terrifying. You can't feel it happening. Your body adapts so gradually that by the time you notice the stiffness, the damage is already deep. Let me walk you through what's actually happening inside your hips right now. Your hip flexor complex, that's the psoas, the iliacus, and the rectus femoris. These muscles are designed to lift your knee toward your chest. Every time you sit, these muscles contract into a shortened position. And here's the problem. Hold any position long enough, and your body says, okay, this must be our new normal. So it starts remodeling the tissue to fit that position permanently. The average person sits 9 to 10 hours every single day. That's your commute, your desk job, your dinner table, your couch at night. And each hour, those hip flexors get a little bit shorter, a little bit tighter, a little bit more locked into that 90-degree bend. Now multiply that by days, weeks, years, decades. What you end up with is hip flexors that are chronically shortened by 3 to 4 inches compared to what they should be. But the real damage isn't just in your hips. When your hip flexors shorten, they pull your pelvis forward into what's called anterior pelvic tilt. Think of your pelvis like a bowl of water. When it tilts forward, everything spills out the front. That forward tilt compresses your lower back, jamming your lumbar vertebrae together. Your body tries to compensate by adjusting your knee alignment, which creates abnormal wear patterns on your cartilage. It's a cascade of dysfunction that starts in your hips and radiates through your entire body. Here's how you know this has already happened to you. Try this right now. Lie on your back and pull one knee to your chest. Watch what happens to your other leg. If it lifts off the ground even an inch, your hip flexors have already shortened significantly. If it lifts 6 inches or more, you're looking at severe shortening that's affecting everything from your posture to your gait. And here's the cruel irony. Your body feels fine because it's adapted. You've lost range of motion so gradually that you don't even remember what full hip mobility feels like. You think it's normal to grunt when you stand up from a chair. You think it's normal to feel stiff in the morning. You think it's just aging. But traditional Japanese culture tells a completely different story. In Japan, people spent centuries sitting on the floor in positions that required full hip mobility. They didn't have chairs, creating this chronic shortening pattern. And when samurai needed their bodies to perform in battle, wearing heavy armor for hours at a time, They couldn't afford tight hips or compensated movement patterns, so they developed specific training methods to maintain perfect hip function. One movement, in particular, became the foundation of their physical preparation. The samurai discovered this reversal mechanism 700 years ago, not in a laboratory, but on the battlefield where dysfunction meant death. Samurai warriors needed their hips to function perfectly during hours-long battles in heavy armor. Their solution? A movement so effective at maintaining hip function that sumo wrestlers still use it today to develop the strongest, most mobile hips in athletics. This movement is called shiko, pronounced shiko, and it's the stability exercise that's been hiding in plain sight for 7 centuries. In feudal Japan, a samurai's ability to hold a wide, stable stance could mean the difference between life and death. They needed explosive power, unwavering balance, and hips that could handle sudden directional changes while carrying 60 to 70 pounds of armor. So they borrowed from sumo wrestling, Japan's ancient national sport, and adapted shiko into their daily training regimen. This wasn't just exercise, it was survival preparation. Here's what makes shiko remarkable. Sumo wrestlers can hold this position for 15 to 20 minutes straight. Think about that. These are athletes maintaining a deep, wide stance that would have most people shaking and collapsing in 30 seconds. But they've trained their hips to not just tolerate this position, but to thrive in it. And before every sumo match, you'll see wrestlers performing shiko as part of a sacred ritual that's remained unchanged for over 1,000 years. When Japanese sports scientists started studying shiko in the 1980s, they discovered something that contradicted everything we thought we knew about flexibility and hip mobility. Shiko isn't a stretch. It's an isometric repositioning technique. And that distinction is everything. When you stretch a muscle, you're temporarily lengthening the sarcomeres, the tiny units inside muscle fibers. But within a few hours, maybe a day at most, those sarcomeres return to their original length. You get temporary relief, but no lasting change. Shiko works completely differently. By holding a specific position under load, you're not just stretching tissue, you're retraining your nervous system to accept a new hip position as normal. Your brain has proprioceptors, sensors that tell it where your body is in space and what's safe. After 20 years of sitting, your brain has learned that 90 degrees of hip flexion is your normal range. Anything beyond that feels dangerous, so your nervous system puts on the brakes. It creates tension and discomfort to protect you from a range of motion it doesn't recognize anymore. But hold shiko for 60 to 90 seconds, and something shifts. Your proprioceptors start sending new information to your brain. They're saying, "Hey, we're stable here. This position is safe. We can handle this." Your nervous system begins to accept this wider, deeper hip position as part of your normal movement vocabulary. And unlike stretching, this reprogramming is permanent. You're not just temporarily lengthening tissue, you're fundamentally changing what your brain considers normal. The biomechanical genius of shiko comes down to 4 key elements. First, the wide stance reduces the load on your tight hip structures, making the position accessible even if you haven't squatted in 20 years. Second, the external rotation of your feet opens up the anterior hip capsule, the thick connective tissue that gets especially tight from sitting. Third, the isometric hold, staying still under tension, triggers neural reprogramming that stretching simply cannot achieve. And fourth, the specific weight distribution creates progressive tissue adaptation at exactly the right intensity. This is why shiko can reverse 20 years of sitting damage. You're not fighting against your body's protective mechanisms. You're working with them, teaching your nervous system that full hip mobility is safe, natural, and sustainable. Japanese elderly, who practice shiko daily, maintain hip mobility well into their 90s, moving with a fluidity that would shock most Western physical therapists. Now let me break down the exact positioning that makes this neurological magic happen. Get this position wrong by even 10 degrees, and you're just doing a wide squat. Get it right, and you'll feel muscles activate that haven't worked in decades. The difference comes down to precision. and I'm about to give you the exact blueprint that samurai used to build indestructible hips. Start with your feet. Position them twice shoulder width apart. Here's how to measure that accurately. Stand with your feet at shoulder width, then take one full foot-length step to the left and one to the right. That's your starting width. Now rotate your toes outward at a 45-degree angle. If you're standing on a clock face, your right foot points to 2 o'clock, your left foot points to 10 o'clock. This external rotation is non-negotiable. It's what opens the anterior hip capsule and allows the deep repositioning to happen. Your weight distribution matters enormously. Press through your entire foot, creating what's called the tripod: heel, base of big toe, base of little toe. All 3 points stay grounded. If you roll to the outside edges of your feet or let your arches collapse, you've just lost the hip opening we're targeting. Now comes the descent, and this is where most people go wrong immediately. Don't bend your knees first. That's a squat pattern, not shiko. Instead, initiate the movement by pushing your hips back and down, like you're trying to sit in a chair positioned between your legs. Your knees will naturally bend as a result, but the hips lead. Lower yourself until your thighs reach parallel to the ground, or go deeper if your mobility allows. There's no prize for going deep if you lose the position, so work within your current range. Your hands have 3 options depending on your stability. Beginners, rest your hands on your thighs for support. This takes pressure off your legs while you're learning the position. Intermediate, bring your hands to prayer position at your chest. This removes the support and forces your legs to do all the work. Advanced, extend your arms straight out in front of you at shoulder height. This shifts your center of gravity forward and intensifies the hip demand. Here are your critical alignment checkpoints. Your spine must stay neutral, not arched, not rounded, but maintaining its natural curves. Imagine a straight line from the top of your head, down through your tailbone. Your chest stays open and lifted. Think about pointing your sternum toward the wall in front of you. Your knees track directly over your toes. Look down. Can you see your toes? If your knees are blocking the view, they've caved inward, and you're setting yourself up for knee problems instead of hip restoration. What should you actually feel? Deep inner thigh engagement. Your adductors should be working intensely. Glute activation, especially on the sides of your hips where your lateral glutes live. A distinct opening sensation at the front of your hips. That's your hip capsule finally getting the space it's been begging for. And core engagement. Your deep abdominals should fire to keep you stable. What you should absolutely not feel: knee pain. If your knees hurt, widen your stance or don't go as deep. Lower back strain means your spine has lost neutral position. Fix that immediately. Ankle discomfort is okay initially. Your ankles might be tight too, and placing a small wedge under your heels can help until your mobility improves. The biggest mistake I see? Knees collapsing inward. This not only misses the entire hip opening benefit, but it also creates dangerous stress on your knee ligaments. Push your knees outward throughout the entire hold. Second mistake, arching your lower back to make the position feel easier. All you're doing is transferring the work from your hips to your spine. Keep that core engaged. Third mistake, rising onto your toes. Plant those heels. If you can't keep them down, your ankle mobility needs work, but you'll get there. Breathing makes or breaks this movement. Inhale as you descend into position. Exhale as you settle into the hold. Then, breathe naturally. If you're holding your breath, you're working too hard. Scale back the depth or duration. Now that you know the how, let me show you why this works at a cellular level. Recent studies from Tokyo University revealed something remarkable. Holding shiko for just 90 seconds triggers a cellular response that begins restructuring shortened hip flexors within 72 hours. But to understand why this works when everything else fails, you need to know the difference between stretching and repositioning. And that difference is the key to reversing 20 years of damage. When you stretch a muscle, you're creating temporary change at the sarcomere level. Sarcomeres are the tiny contractile units inside your muscle fibers, like links in a chain. Stretching pulls those links apart, lengthens them for a brief window of time. You feel looser, more mobile. But here's the problem. Within 2 to 6 hours, those sarcomeres return to their original length. Your nervous system says, "That was nice, but we're going back to what we know is safe." You get temporary relief, maybe enough to get through your day, but zero permanent adaptation. Shiko operates on a completely different mechanism. This is neurological reset combined with structural remodeling. Think of it like reprogramming your body's operating system instead of just closing a few apps. When you hold an isometric position under load, you're not just stretching tissue. You're sending a sustained signal to your brain that this position is safe, functional, and necessary. Your nervous system begins to accept this new hip range as part of your normal movement vocabulary. That acceptance is what makes the change permanent. But the magic goes even deeper, into your fascia. Fascia is the connective tissue that wraps around your muscles like shrink wrap. When you sit for 20 years, your hip fascia doesn't just get tight, it actually shortens and thickens, creating a physical barrier to hip extension. Here's what's fascinating. Fascia is incredibly adaptive. It remodels based on the positions you hold over time. Sitting position equals fascia shortens. Shiko position equals fascia receives a lengthening signal. Hold shiko for 20 minutes per week, and you'll get measurable fascial changes in 4 to 6 weeks. Your tissue literally rebuilds itself to accommodate your new movement pattern. The proprioceptive reset might be the most crucial element. Your brain has sensors called proprioceptors that constantly monitor joint position and muscle tension. After decades of limited hip movement, your proprioceptors have basically forgotten that full hip range exists. They send danger signals the moment you try to move beyond your adapted range. But isometric holds re-educate these sensors. You're teaching your nervous system that deep hip positions aren't dangerous. They're natural. This creates new motor patterns that stick with you permanently. Research on muscle activation tells us exactly why shiko outperforms conventional approaches. EMG studies, that's electromyography, show that shiko activates your deep hip rotators at 73% of maximum voluntary contraction. Compare that to conventional hip stretching, which only hits 28% activation. You're not just lengthening tissue, you're building strength in your new range of motion. That combination of length and strength is what creates lasting change. The hip joint capsule itself undergoes remarkable transformation. This thick connective tissue surrounding your hip joint literally thickens from disuse, like scar tissue forming around an injury. Shiko's combination of external rotation and depth creates a specific capsular stretch that gradually expands the capsule over time. Think of it like slowly stretching a leather glove. Apply steady tension regularly, and the leather expands to fit comfortably. Rush it, and the leather tears. Your hip capsule works the same way. Here's the comparative data that changes everything. Standard hip flexor stretches provide temporary relief with no measurable structural change. The Tokyo University study tracked participants doing shiko 3 times per week for 8 weeks. The results? An average hip extension increase of 8 to 12 degrees. That's not just feeling better. That's documented, measurable reversal of sitting damage. And there's a bonus most people don't expect. Weight-bearing isometric positions like shiko activate osteoblasts, the cells responsible for building bone. Practitioners over 50 show measurable improvements in hip and spine bone density. You're not just reversing soft tissue damage, you're literally strengthening your skeleton. Understanding the science is one thing, but integrating this into your life is where the real transformation happens. Here's your roadmap. Week 1, you'll hold shiko for 20 seconds and feel like your legs are on fire. Week 8, you'll hold it for 3 minutes and wonder how you ever lived without it. But the journey between those 2 points is where most people either transform their hips or give up entirely. Let me show you exactly how to progress so you're in the transformation group. The principle driving your progress is called progressive overload, and it's beautifully simple. Time under tension equals adaptation stimulus. Your body doesn't change because you worked hard once. It changes because you consistently asked it to do slightly more than it did last week. Here's what most people don't know. Your body doesn't care about the timer. It cares about the challenge. Some days, 30 seconds will feel harder than 45 seconds did last week. That's normal. Listen to your body's feedback, not just the clock. Weeks 1 and 2 are your foundation phase. Your single goal here is learning correct position and building initial tolerance. Hold shiko for 20 to 30 seconds, 3 sets total. Practice every other day. This gives your nervous system time to process the new movement pattern and your tissues time to adapt without overloading them. Focus entirely on form over duration. If you're shaking, that's normal. Your stabilizer muscles are waking up after years of sleep. If you need to use a chair for support or reduce your depth, do it. Perfect position at partial depth beats terrible position at full depth every single time. Weeks 3 and 4 shift into the adaptation phase. Now, your goal is increasing duration while refining your positioning. Aim for 45 to 60 seconds, still 3 sets. But increase frequency to 5 days per week. Your body is ready for more regular stimulus. This is where you dial in your breathing rhythm. Inhale for 3 counts, exhale for 4. Keep that pattern steady even as your legs start to fatigue. You'll notice less shaking, a deeper opening sensation at the front of your hips, and the position starts to feel almost comfortable. Almost. Try removing hand support for portions of the hold. Even 10 seconds without touching that chair is progress. Weeks 5 and 6 are the integration phase, and this is where it gets exciting. Extend your holds to 90 seconds, maybe push toward 2 minutes. Drop down to 2 or 3 sets since you're holding longer. Practice daily now. Your nervous system has accepted this position. Time to challenge it with variations. Shift your weight slowly from side to side. Lift one heel slightly, then the other. Experiment with arm positions. Reach your arms overhead, out to the sides, or into that prayer position at your chest. You should feel genuine strength in the position now, and you'll notice hip mobility showing up in daily life. Stairs feel easier. Getting out of your car doesn't require that little grunt anymore. Weeks 7 and 8 are your mastery phase. 3-minute holds become your target. You might only do 1 or 2 sets because the intensity is real now. Practice daily. Focus on absolute stillness and meditative breathing. See how deep you can descend while maintaining perfect alignment. The advanced option: close your eyes during the hold. This removes visual feedback and forces your proprioceptors to work overtime. You'll feel your balance system strengthening in real time. By week 8, you should feel comfortable, even peaceful, in a position that seemed impossible 2 months ago. Here's how to weave shiko into your actual daily life. Morning. 1-minute hold right after you wake up. This counteracts the stiffness that builds overnight and sets your hip mobility for the entire day. Midday. 30-second hold to break up sitting. Set a timer for every 2 hours if you work at a desk. Evening. 2 to 3-minute hold to release the tension that accumulated throughout the day. This improves sleep quality because your body isn't fighting against tight hips all night. Track your progress with measurements, not just feelings. Week 1. Do the lying leg test I mentioned earlier. Pull one knee to your chest and measure how high your other leg lifts. Week 4. Test again. You should see a 3 to 5 degree improvement. Week 8. Final measurement. Expect 8 to 12 degrees of improvement. That's documented reversal of structural damage. After 8 weeks, you don't stop. You maintain. 3 to 4 times weekly. 2-minute holds keeps everything you've built. 5 minutes of practice weekly maintains your reversal for life. If you hit a plateau, increase frequency before you increase duration. If persistent tightness shows up, add gentle dynamic movement before your holds. Some hip circles, leg swings, anything that warms up the tissue. This isn't just about your hips anymore. It's about what happens when you restore the foundation of your entire movement system. 20 years of sitting damage didn't happen overnight, but the reversal? That starts the moment you drop into your first shiko position. Remember that toddler squatting to pick up a toy? Perfect form. natural mobility, hips that work the way they're designed to, that's not lost forever. It's just locked away, waiting for you to reclaim it. Hip restoration isn't just about moving better. It's the gateway to full body mobility, the foundation for aging with strength instead of surrendering to stiffness. This one movement, this ancient samurai secret that's been hiding in plain sight for 7 centuries, gives you back control over your own body. The Japanese have known this forever. Now you do too. Here's what the next 8 weeks look like. First week feels challenging. Your legs shake, you wonder if you're doing it right, you can only hold for 20 seconds. First month brings noticeable improvements. Stairs feel easier, your back doesn't ache as much, you move with more confidence. 8 weeks gives you measurable structural changes. Your hips have genuinely reversed decades of damage. 6 months? You'll have hip function you forgot was even possible. But only if you start. 15 minutes weekly is the minimum. Consistency beats intensity every single time. Small daily practice destroys sporadic effort. This is your choice, your control, your reversal. Drop a comment right now and tell me, how many years of sitting damage are you reversing? If we hit 500 comments, I'll reveal the second samurai movement that targets your shoulders and spine. Subscribe so you don't miss it. The samurai knew that hip strength was life strength. Your reversal starts today.